Good afternoon. It is such a pleasure to be with you in this last session where we are going to look at the European health data space. I think I have a noise interference. It's a pleasure to be with you today on this last session. We have an amazing list of speakers for you, and we're going to discuss something which is very close to all of our hearts and something that we all know about a little bit, but probably not quite as much as we would like to, which is the European health data space. The European health data space is a key milestone for health data and digital health policy at EU level, and in fact, probably at world level. It's a unique opportunity to build new approaches to health and care, and it's an opportunity to really put patients and patients' needs at the center of building this new initiative. So in this session, we're going to look at what the European health data space is, but then we're going to look very importantly at what you as patients want from it, but also what you as patients can bring to it. And we're going to do that through a couple of poll sessions that I will introduce to you when we're ready to do them. But I want to already ask you to be sure that you can see on your screens where the polls are. So the polls are the third along the chat bar. You have chat, and then you have at the end polls. So when I tell you that a poll is open, do please click on that. So let me just quickly tell you who we have with us today. We have with us Toni Andreu from the European Infrastructure of Translational Medicine. Toni is a medical doctor and has a PhD as well, and he's specialized in genetics and genomics of rare diseases. He's been working in the field of neuromuscular disorders for a long time and has a very keen interest in making sure that data really works to advance science in his area. We're also joined by Cecilia Bonefeld-Dahl, the Director General of Digital Europe, which is, of course, the leading digital technology industry association in Europe, representing some 35,000 digital companies across the European Union and beyond. She's active in a wide number of groups, including the Gaia X initiative, which is, of course, something which will run in parallel and support also the work that continues within the European health data space. We're very privileged to have with us also Elizabeth Kasagam, who is the CEO of the European Multiple Sclerosis Platform, but is also currently acting as the Executive Director of the European Patients Forum. So she is not only with us here, but also to some extent our host. And we have with us Ioana Gligor, who is the head of unit in DG Sante and the head of unit responsible for digital health and the European reference networks for rare diseases. Now, I'm going to say something about Ioana that I haven't checked with her, so I hope it doesn't offend. But I would like to say that, Ioana, you are to some extent the midwife of the European health data space, which is you are really playing a key part in its birth. But rather than using the English term midwife, I would prefer to use the French term of sage-femme, because I think what you really have to bring to this is a huge amount of knowledge and wisdom, as a sage-femme does. And that's what we're very keen to hear about and to learn more about from you, about what the European health data space is seeking to achieve. Ioana is going to present to us just in one slide what the European health data space is. And that's a big challenge because she could, of course, speak for much longer, but she's just going to give us that background, and then we're going to go into a discussion round. So with that, I'd like to hand over to you, Ioana. Thank you very much.
Thank you very much, Petra. I think it's a collective wisdom that we try to put around the European health data space, and I think I would share this sage-femme task also with other stakeholders, also with the member states, and also with the organizations like the EPF that we have been trying to get insights from during the long consultations on how to structure the European health data space. And I think it's really a collective wisdom that hopefully will support in having a European health data space that can make a difference in patients' lives. And if you go to the next slide, hopefully that can give you a little bit of an overview of what we are thinking based on the this collective wisdom of covering under the European health data space. If we go to the next slide, please. So you would see there that the European health data space means use of data for the healthcare, support for provision of digital health services within Europe, but also the reuse of health data for research, policy making, and regulatory purposes. So coming back to the first pillar, the primary use of health data, as we call it, the role of the patients, of the individuals in accessing and controlling his or her data, it's absolutely fundamental. And this is what we try to do and to try to reinforce in the context of the European health data space. It will build, for instance, on the GDPR. As you know, for instance, the GDPR provides the possibility of access and portability of the data. But what we are actually seeing in practice, this is relatively limited. And the effects are seen in terms of impacts on the patients, in terms of not having enough information about the patient when he or she changes healthcare providers, on when he or she travels to another member state. For the healthcare professional who is in the other member state. Working on the legal proposal, for instance, we have seen that around 10%, for instance, of the images which are being done yearly in the healthcare system in the EU, and that's quite a lot. It's around 14 billion euros. They are unnecessary. They are duplicates. So if we could, for instance, just save money for your pockets, for the healthcare system, just from trying to avoid these unnecessary images which are being done by ensuring the interoperability, that would be a huge gain for you and for the healthcare systems. We have also seen, for instance, that the fact that the prescriptions are not coded, are not e-prescriptions, this can lead to huge waste. I mean, I think, no offense, Toni, we are also using, for instance, the term writing of a doctor. This can also lead in numerous cases to not understanding what has been prescribed. And think, for instance, in cross-border cases, where the language barriers is added to the whole complexities, this can really provide huge barriers. We have been calculated that, for instance, only in the cross-border context, having e-prescriptions among the member states over 10 years could lead to savings to up to 500 million. And that's only a limited part of the things. Also, for instance, telemedicine could allow both provided nationally and cross-border, could allow for more efficiency gains, for a better triage, for a reduced implications, and also for access of the patients from remote areas. So the purpose of the European health data space in the context of the primary use of health data is to support that individuals have access and control their health data. They can share it with the healthcare professionals of their choice, and can also share it when traveling abroad. For this, for the cross-border aspects, for instance, many of you may know that we have already an EU-wide infrastructure called My Health at EU, which allows the patients to share his or her data with healthcare professional of their choice in the language of the healthcare professional. We already have 9 member states which are part of this infrastructure, already over 20,000 e-prescriptions dispensed, and around 300 patient summaries. So we are planning to take this work further to also develop the aspects related to the interoperability in order to really give a meaning to this all these aspects that I have mentioned. On the reuse of health data for the research, innovation, policymaking, statistical purposes, I think the crisis has showed us how important it is to support this. Both for the policymakers, but also, for instance, for the pharma companies, repurposing of drugs for being reused for the COVID crisis, better information about what treatment work best, how to support the COVID patients. These were just some examples which show that much more needs to be done. And we have the possibility under the GDPR, for instance, under the articles related to access to data and use for public interest, for combating health threats, ensuring the safety of pharma and medical devices, but also scientific and statistical research. We have the possibility of having a European law which provides a more level playing field, because what we are seeing now is that the current system is very fragmented. How the GDPR has been implementing at national level is really fragmenting, which has led also to, which has impacted and has hampered the effectiveness of using the data. So there we are also trying to see how we can offer this level playing field, and how we can also support through a new infrastructure cross-country analysis of the health data. How can we support, for instance, the work of the regulators, EMA, of policymakers, of institutions like ECDC dealing with cross-border health threats, but also how can we support the innovation? So these are areas where we are working upon. You see there in the lower part, at the foundation of the action, the legal aspects. We are planning to come up with a legal proposal in the first part of 2022. The infrastructure, I mentioned already My Health at EU. I mentioned also the infrastructure for secondary use of health data. There are also important infrastructures which are being set up in the member states using also EU funds. And there I would like to recall again the important opportunity offered by this current multi-annual financial framework with the Recovery and Resilience Facility, European Regional Development Fund, InvestEU, and other funding that could add up to the national investments and could really support the development of digital health services, quality of data, etc. So I would stop here, but I would be extremely interested to hear the collective wisdom that could be injected in the work on the European health data space, because I think we are all doctors and such farm in this endeavor. Thank you very much.
Thank you, Ioana. That's a great input. So the poll is open. I see that a very large number of you have already voted, and you have seen that the first poll is where we're asking you to choose an option of what you think you would really like the European health data space to bring to you. So is it about free movement around Europe with electronic health records? Is it about securing safe and transparent use of data, or enabling better research through data, or to enable easier access to control of your own data? Of course, you would like to tick all of those. We would just like to have some idea of what your inputs is, but also, and I can already see on the chat, some people are already beginning to say that there may be other issues as well. So I'm just going to give you another 15 seconds to vote, and then we're going to close the vote and see what you've come up with. So if you could close the vote, please, and then I will see something of what your results are. And then we're going to move into the discussion with the panelists, where I'm going to be asking the panelists to tell us a little bit about what their expectations from their communities that they represent are of the European health data space, but also what they are going to bring to the European health data space. So I'm still waiting to see the results. And while I'm waiting for those, okay, I'm not getting the results just yet, but I'm going to perhaps ask to begin with Toni. And Toni, I'd like to begin by asking you, and we'll share some of the results after you've given your input on what do you from the medical research community, what is it that you expect of the European health data space, and what are you going to bring to it? Toni, over to you.
Thank you, Petra. Well, I think that maybe a couple of messages that I would like to share with the panel and with the audience from the perspective of the research domain. I would say that my first thesis is that there is no clear border in between research data and health data, because one feeds each other. And actually, many of the latest innovative interventions that we have access to in the healthcare system currently in Europe, they come from the research experience and from the research domain. And in the work that we have been doing in the research domain, in the biomedical research field, generating data pipelines, there is, over the last 10 years, an increasing concern about one critical element that also we can transfer to the strategy of the development of the European health research data space, which is the issue related to quality and reproducibility of data. In the research area, we have strong evidence accumulated over the last few years that quality and reproducibility of research data at the source, primary data, becomes a real barrier for progressing the translational pipeline of using this data for generating solutions for unmet medical needs. And I think that the experience that we have developed could be very useful also for the development of the European health space. One of them is the concept of fair data. Fair is a very interesting word that represents the interconnection of different values, ethical and societal values. But in the context of the health of the research data, stands for four important elements. Fair, F from findable, A from accessible, I from interoperable, and R from reproducible. And I think we need to work on these four pillars to maximize the capacity that we have from the research domain to bring the analysis that emerges from research data pipelines to provide solutions that can be implemented in the health space.
Thank you very much, Toni. I love your idea that there is the border between care and research data is really beginning to blur. That may pose a challenge for the legislative side and the GDPR interpretation, because of course the GDPR sees the distinction, but that's of course one of the challenges that we're going to be rising to. Let me just quickly, before I move on to Cecilia to ask her about the view from industry, share with you the results of the poll. So what's interesting, I think, is that there is almost an even balance, but that we do see that for patients, and we are predominantly a patient audience, that it is about access to control of the health data that concerns you and freely being able to move around Europe. But it's interesting that there's a very even spread, which I think is probably because we think the whole of the European health data space is important to us. Cecilia, may I move to you? You represent the vast majority of industry players in this space. The European health data space will build on other initiatives that you're also involved in. But what do you hope that it will deliver, and what role do you see for your community?
So what will it deliver and what should it deliver? Maybe let me start by saying thank you so much, Ioana, for driving this, and we are huge supporters, and thank you so much for inviting me to this. The patient and the citizens should be the center of attraction and attention here. And I mean, there are a few things where we can actually start. It's not an easy task, but it's actually some concrete tasks that we can start to actually do now. One is that we don't have a common consent form, a standard for how patients actually accept the reuse and use of their data across Europe. So how do we develop that standard? This is something that we need to do before we can even start using it, the patient data across Europe. Second of all, I mean, health data in general, standardized standards for health data, there's also still quite a big job to be done in harmonizing the data standards. And without getting the data and without having the patient being able to give consent to the use of data and really understanding in an easy, usable way how to do that and how it will be used, then we cannot implement. So this is really a prerequisite. Then, of course, an EID. We have countries where, my own country, Denmark, where we have an EID and where it's something that we consider a part of our reality and also allows us as patients to access our data across the board. But for many, many, many countries, this is not a fact. So EID and consent form or consent standards is absolutely crucial for the infrastructure of the data space and the use of the data. Then maybe just saying the electronic health records too. Again, in Europe, we have countries that can really use this and they have implemented it. And then we have countries that haven't even started. So how do we make sure that all this data is actually used actively when the patient is sick also? Of course, we're talking prevention and all the great things that we can do, but how do we make sure that that device, when the nurse is meeting you or the doctor is meeting you, is actually bringing the correct data in a very easy way, so it doesn't really take away time from the caretaking of the patient, but really benefits. And that's where I think the patients play a major role. Already now, we need huge investments in upskilling of the caretaking staff. They need to tell us how they most efficiently can spend more time with the patient and give data and use data in a very efficient way. I know that some of the system that has been implemented, they are taking away time away from the patients. And this is, of course, what cannot happen. So before we even launch the European Health Data Space or use it for electronic health records with the patients, we need to make sure that the caretaking staff has a proper input and can tell us exactly how this can happen. So what do we bring? Of course, Digital Europe is actually not only for, you can say, traditional digital companies. We have our fastest growing area is actually pharma companies, medical companies, medical device companies. And we have shaped this kind of cross-sectorial board where we are discussing exactly these solutions. And I really think that we are the ones, of course, that can provide, we have knowledge of data. We know how we do cybersecurity. We know how we do data crunching, you can say artificial intelligence, how we collect data standards. This is our responsibility. But again, I must also highlight that up to 70% of the member states, they say that they do not have the proper cybersecurity and knowledge or skills to actually use the data. So we need to do that now. I'm very, very happy that we're starting this now, but we need to have two parallel tracks that make sure that the caretaking personnel and the patients tell us how we do this and how we can use the data in the most efficient way. So you play a major role in this, and you are, if you don't know, you can say you are the end, the patient is the end customer, and we must never forget that. A bottom-up process of how we actually make the most of this data. And then the technology is there. We have the cybersecurity, we have the infrastructure, we know how to do data standards, but it is really the harmonization across the member states, a truly European data space, a truly European rollout that will matter for the patient.
Excellent. Thank you very much, Cecilia. And I can see that some comments in the chat, people are agreeing with some of the points that you've made. We're going to come to some of the questions on the chat in a moment, but I'd first like to hand over to Elizabeth to ask her to share the feelings from the patient community also on what is wanted, what is needed from the European Health Data Space, and your feelings about it. Thank you very much, Elizabeth.
Thank you very much, Petra, and good afternoon, everyone. First of all, I'd like to really start with saying that we really welcome this initiative of the European Health Data Space. It's key for patients, and we know that having more data also improves the quality of the the care that the patients will receive at the end. So the outcome is really important here. And we also value the fact that the data will be based on the patient expertise. So we really we'll talk about this later, but the role of the patients in this whole framework is important. In terms of our expectations overall, we really would like to see the improvement in terms that of the framework of the health data, that there is an harmonized way of addressing this framework, so that the patients themselves, and as it was mentioned before by Ioana, have access and control over the health data, and that the reuse of the data is well established in a clear, transparent, trustworthy framework that patients can understand. So it has to be really in terms of accessibility, it has to be clear for the patient what it means. And often that has been an issue in terms of the consent forms, in terms of the clarity of what's going on. And as you know, in this digital era, there's a lot of concerns that are raised by the patient community. So we expect really to have a clear framework which is built on those concerns, but addressing also the needs of the patients. We really believe that here there are a lot of best practice synergies that can be created with existing initiatives, and tapping into that would be also a way not to start over, but really be able to build the future based on the learnings from everything that has happened till now. So that is something that is really important. And the other key point also is that in terms of the use of the data, and it's to tap into the experience of the patients, to be able to address the challenges and the needs of the patient. It's really important that the mechanism in place here integrate a meaningful involvement of the patients throughout the processes of dealing with the data. So what data are we collecting, and then how we are processing this data, how it is being reused. Everything needs to also include the patient's perspective, and that they are involved across the system that will be put in place. So we really believe that, you know, for the patients to be able to contribute in a meaningful way, this framework needs to be really well thought through. And also the last kind of remark I would say here is really to build on the capacity building potential is important, so that we really used, and something that Cecilia mentioned for the healthcare professionals, how to use the data is important. For the patient, it's also the same, how to contribute, how to understand and see the value of sharing the data is also important. So I think there should be an educational process for all the different stakeholders that will have access to this data and that will be using this data.
Thank you. So interesting to see that from both the patient side and the industry side, the skills gap issue is being highlighted and something we need to think about. I'm going to just move on to a couple of the questions that have come in on the chat. And I'll like to begin by Ioana asking you to comment on the question that came in from Juan Jose Fernandez Romero, asking about the interplay and overlap between the European health data space and the extended mandate of the EMA. Would you like to answer that?
Yes, thank you very much. So the new renewed mandate of EMA foresees also among the tasks of the European Medicine Agency the possibility to have access to data in order to ensure pharmacovigilance. Now, what does this mean in practice? It means basically that EMA can also look at data concerning the effects, for instance, of certain medicinal products that it has been authorized, and adjust its recommendations or take additional actions. Now, how to do that? Probably some of you have heard about the Darwin project, whereby EMA is setting up and infrastructure. Now, in the context of the European health data space, we are aiming at supporting basically the EMA to have access to data. We are going to launch a pilot project this year, actually, aiming to support a collaboration between EMA and data access bodies or data permit authorities or data authorization bodies. How do you want to call them? What are those data authorization bodies and also with research infrastructures, are basically the data authorization bodies are institutions set up in different countries like Finland, France, Germany, Norway, Denmark, etc., which have been mandated by the law to provide permits for accessing health data for very clearly and defined purposes, like public interest, like scientific research, etc. So the idea would be that, and this is something that we are looking with a lot of interest in the context of the legislative proposal for the European health data space. So how does it work concretely and in practice? For instance, FinData gets a research question from the from a researcher or from a company, analyzes it from the perspective of ethical data protection aspects, from the compliance with the criteria set out in the law, outreaches to the data holders, pseudonymizes or anonymizes the data, and makes it available to the researchers or the policymakers on a secure space. The data normally is processed on the secure space. So what does this mean in practice? It's processing the data based on a law, national law in this case, with a trusted governance and in a very secure way. So this is something, again, that we are looking with a lot of interest in the context of the European health data space. And we are also trying to support EMA to get access to a wealth of data by basically using these trusted governance and infrastructures which have been set up at national level. For the other countries, EMA is also working on possibility of having agreements with the data holders. However, one should also take into account that the costs may be much higher, and also the cost of common data model verification of data can be considerably higher. And we are again looking at ways of trying to support and to maximize access to such data for different purposes. So I hope that I have replied to the question. Thank you.
Thank you very much. It's good to hear about the planned collaboration. I would also I'd like to turn out to quite a different issue, but and to direct the question to Toni, and then after Toni we'll hear some more inputs from the panel. But Toni, you used the acronym FAIR, and Valentina Stramiello said that there's an interesting thing missing in fairness, which is fairness. Would you like to make a comment on about how fair the FAIR principles are?
Sure, Petra. I completely agree, because I think the concept of FAIR is a challenging concept for talking about the challenges of the research data space. And I think it focuses pretty much these elements of findability, accessibility, interoperability, and researchability on the reality of having an extremely fragmented data space. And this is, let's say, a technical pathway that needs to evolve, but has to be built in parallel with the societal level that embraces the concept of fairness. And we have been discussing, for instance, the unequal levels of digitalization, digital skills, cross-border equal and fair access to health data. At the end of the day, if we want to create a continuum, positive continuum of the value chain between the research area and the health area, developing a strong European health data space, we need to be very brave and very, very positive in implementing this element of fairness in the development of this journey. And for me, the critical path for doing that is doing it together with the patient community. And that means involving the patient community at early stages of the research process where data is generated, because we need to have this multi-omic perspective. And in that case, the patient perspective is absolutely essential to reshape this data journey, this data pathway, to make sure that the outcomes that are going to be generated are going to be brought to the clinical decision-making process and are going to, at the end of the day, reinforce the robustness of the European health data space.
Excellent. Thank you very much. So let me go back to the panelists. So you've made some statements about what you want the European health data space to deliver. But of course, the European health data space, although it will be developed within the framework of some legislation from the European Union, and it will be supported by an infrastructure, it is there for the stakeholders, and it needs to be shaped by the stakeholders. So Cecilia, maybe I can ask you first, from the industry stakeholders' point of view, what do you want to bring to the table to shape the European health data space so that it can work not only for you, but for everyone?
I mean, what we bring from the industry is a huge amount of knowledge on how to work with data, how to structure data, how to build safe infrastructures, how to create medical devices that are inclusive also and can be used by non-super technical staff. What we also can bring to the table as an organization is, of course, that we have 40 organizations around in the European member states, and is a close contact with the member states' policymakers. And one of the biggest needs is really a renewal of many of the national systems. If you want to collect correct data, you need to do so in infrastructure and devices that are cyber secure, that are updated. We all know many of the cybersecurity disasters has happened because their devices are old, they are not connected to a cloud, so they're not updated, et cetera, et cetera. So this is very, very important that we have updated material, the latest standards, and that we do this with a patient-centric view of how to use this. And this is one of the reasons why we engage. We have a group that is looking at nothing but inclusiveness and accessibility of technologies for, amongst others, non-technical people like elderly people, or even, of course, medical caretakers. So an updated infrastructure is definitely one of them, but also, I mean, it's really one of those projects where we need to work industry, patients, organizations, and public sector, and of course, health authorities, really, really close together. And we come with a knowledge that is quite specific here, and a, savvy way of working with data and infrastructure and security, because this is what we do. But we do need to have a large amount of knowledge coming bottom up from the patients and from the medical caretakers.
Thank you. It's amazing to see how these things just keep converging. But I'm very delighted to hear you talk about the need for the renewal of the system. We could end up with a situation where we have an amazing functionality of a European health data space, but just not the environment in which we can really make the best use of it, and in which we can allow your members to really bring what they have so much to bring to this table.
I actually think that path, again, one of the other things that we really bring to the table is that we have been implementing technology. This is also what we do, right? And to really think about parallel tracks. Let's just take something like GDPR. We all love it. Did it make, small companies in Europe more competitive? Definitely not. So if we think in the same way, how can we prepare the grounds? How can we make sure that the hospitals are ready with the right devices, that the healthcare workers know how to use technologies, that we have updated infrastructure, that they know security procedures, etc., that they are ready to actually do that. That is the path that we need to think, not now we do the data space, then we do the rest. We really need to drive those two parallel tracks, and all four parts, I would say, the patient organizations, the industry, public sector, of course, with the European Commission, really play a major role. Also, I think, GaiaX is, of course, also working on this. We are, as Digital Europe, is working on this. But it is also a public sector responsibility, and therefore we might even see the Cloud Alliance from the Commission really playing a major role also in bringing this to life, also with the member states. So
thank you. Thank you. I think you raised a number of very rich comments there, and I think we'll get some interesting engagements from the floor on this. Elizabeth, we've heard about what patients want from the system, but what is it that you think is really needed to allow you to buy in? We've heard a lot about the needs for education and support, about preparing the ground and the field, renewing the environment. From a patient's perspective, is there any particular need that you have in order to really make the potential of the European health data space come alive?
Yeah, thank you, Petra, for this question. I think that's really straight to the point. We have to get the buy-in of the patient who would be the one contributing the data. It's really important that we start educating them and that we start building this trust. I think this was mentioned in the earlier sessions this morning, is like ownership and collaboration can help to build trust. And this is where we need to kind of work together as with all the stakeholders involved in the process, so that we can really help to accompany the patient in that journey, also of sharing the data, understanding how it is used, and making sure that their contribution is reliable, that they can provide quality data, and that this can be done on a continuous way. So we have to build this education. So we have to talk to the patients. We have to develop material that can help educate them on this. But beyond that, I think what is also important from the patient community is that they also see how the data and the impact of the data at policy level, and also at in research and innovation, how the data is used. And by just explaining and being clear on what is the outcome of the use of this data, we can get to this trust that we need from the patient community, so that they can be involved. The other very important key message here would be that to involve with this community, we also need to give them the right seat at the table, not just involve the patients, but really co-design with the patient at the very beginning, not only the framework, but also the different system where they are going to get involved, and value their expertise. So that would really help to bridge the gap between the different stakeholders, and specifically the patients community. So we have to take into consideration that not all patients community across Europe are at the same level, also within each healthcare systems. So we need to meet them where they are. And there are some comments made about the inequalities on the chat. And I think that's very important, that when we're building this framework, we're also aware that there are different level in different countries, and that we need the patients where they are. And that would really help to build up that trust and that communication that could be long-term, more sustainable.
Thank you very much. Some interesting themes coming through here. I'm going to ask Toni to comment on what the research community needs to get the buy-in of people like him into the European health data space. And while Toni is speaking, I'm going to ask also to open the second poll to get a little bit more input from you all, to see what you would like in order to ensure your buy-in into the European health data space. So Toni, what is it that researchers need? And I'm sure you're going to build on issues that we've already heard from Cecilia and Elizabeth.
Indeed, and I think these are very good news, because it means that from different perspectives we share a common diagnosis and we see a common horizon. And I echo Cecilia and Elizabeth's words that this concept of creating a common journey between different multi-stakeholders is essential for the development of the European health data space. I think that as a whole, the research domain has a strong willingness for being part of this journey. And we have learned during the last years that establishing a real and honest dialogue with the industry, with policymakers, with the patient community, healthcare providers is essential for finding the right solutions for moving forward. I think that there are two elements that are going to be essential for the development of this culture of multilateralism in the development of the European health data space. One of them is the working on stories of success, because we do have stories of success that can show to the public, can show to the patient community, to policymakers, to everybody involved in this journey, that when we work together, we can efficiently use data for providing solutions for unmet medical needs. And this is going to be, from now on, a particularly relevant challenge if we want to develop the concept of personalized medicine in Europe, because personalized medicine understood of the framework by which we will be able to provide the best treatment, the right treatment to the right patient at the right time, requires a very, very extremely perfection use of the big data, because you can develop only tailored solutions if you have a very precise perspective of the big picture. And to do that, we all are necessary. This is a journey where everybody has to be on board. And I think the trick will be to find this common language, because at the beginning, when you start sharing this journey with other stakeholders, you can feel that there are communication barriers related to the cultural framework where we have been developing our expertise. But after a very, very short period, you realize that we can really build this common language. So for me, this is the critical element, this multi-stakeholder perspective for the strategic development of the European health data space.
Thank you very much. Now, I'm being a bit unfair, because I'm going to ask Ioana to reflect a little bit on what you've all said about how you as stakeholders are willing to and want to contribute, because of course part of the Commission's job is to listen to the stakeholders, but that can also sometimes be herding cats because there are many stakeholders and many ideas. So Ioana, would you like to reflect a little bit on what you've heard from the panel, but also how the Commission seeks to work with stakeholders in this session in building the European health data space?
Yes, thank you very much. Indeed, I mean, we have been working with stakeholders already for quite some time, not only in the context of different consultations, but also in the context of the e-health stakeholder group and Digital Europe, EPF, etc., have had a very, very active contribution. For instance, on the discussion we had in that context related to the acceptance of the European health data space. We had a few months ago a very interesting and very rich webinar on this. This is something that we are also planning to take this forward in the context of the European health data space. There are actually quite interesting models. For instance, in the context of the French data hub, the patient representatives are involved into the analysis of the different projects. So this is something that we are looking with a lot of interest as possible models. There are also a possibilities of having a more structural involvement of the stakeholders representative in the governance bodies at the European level. We have had several discussions, for instance, with the e-health network and the representative of patients, industry, etc. And this is something that clearly we plan to take forward and we replicate. So this path of constant collaboration between and constant consultation and involvement in the decision making between the member states and the stakeholders will clearly something that will continue in the future, also building upon the experience accumulated so far.
Thank you very much. And of course, I think many of us here in the audience have had the benefit of taking part in the stakeholder building that you've been undertaking for well over a year now, actually probably nearer 2 years. So, but I'm sure you'll join me in saying it's not too late for people still to make comments and to engage with you, because you are always open to hearing more about what stakeholders, and particularly the patient stakeholders, want and need.
Maybe if I could just complement, I think the European health data space, the legal proposal is just the beginning of a process. So the legal proposal will set out the principles, the overall framework, but implementation will last years and years. And I think basically this is where we need to make sure that the stakeholders are on board also in the implementation phase, because that will be very, very complex and challenging.
It is, as you say, only the beginning of a story. I'm hoping now that our poll has closed and we're going to be able to see some of the points that you may have liked, or the additional issues that you have raised in terms of in the poll, where we asked you to talk about what would be needed for your buy-in, and we highlighted the importance of transparency and clarity on the framework of the EHDS as a whole. Increased data, digital health and literacy skills, so the educational piece we've been hearing about, and the enhanced trust and safety feeling about health data sharing. And then finally, clear information about how data is actually used. So we'll wait for those results to come in. And let me just actually give a moment to see if the results will come in. Otherwise, I will go on and give a little bit of a summary of what we've heard so far, and then come back to our panelists to make a little bit of a comment. It's taking a bit longer for the results to come in than I had hoped. So let me try and summarize a little bit the 4 big streams of issues that I've heard. So the first one, and they're not necessarily in order of importance, it's just a way of building out the ideas, is that there is, the European health data space is a new initiative, and it needs new infrastructure, it needs new tools, it needs a new commitment, financial commitment as well from the member states to actually make it work. It needs an infrastructure that can actually support fair data. The European health data space will not work at all if there isn't any data to put into it. And that means that data must be fair so that we can actually repurpose it and reuse it and make it accessible through the European health data space. And I've just seen the results now. We've got at the top of the poll in equals top are transparency and trust, which are no doubt very closely linked to each other. And then the clear information about how health data is used and increased literacy at 18 and 12%. So I think that will fit quite well into the issues that we have highlighted here today. So just recapping, rebuilding that infrastructure is clearly very important. The second element that we heard about then, I think, was very much about education and the importance for having new and targeted and appropriate education so that both healthcare professionals, patients and researchers and everybody can actually make the best of the European health data space. We've heard, and Ioana has reiterated, that it's all built on collaboration. And then I think, as our poll shows here, and as we've heard throughout, the magic source in all of this is going to be trust. But trust isn't created, it isn't built, it is earned. We earn trust, and we earn trust, I would say, probably by undertaking that renewal of the infrastructure, by educating and by collaborating. So if our ultimate objective is to earn the trust of the doctors, of the patients, of the scientists, of the other healthcare professionals, how, and I will give the last word to the panel each in turn, how do you think we can best go about building that trust? And where do you think we stand already on that question of trust? And Elizabeth, I'm going to jump to you first, because patients are the ones clamoring, as we have seen here, for better trust and better transparency. Would you like just to say 2 words on trust? And we really only have a minute, half a minute each to round off on trust. Thank you, Elizabeth.
Thank you, Petra. Yeah, very shortly, I think regarding the trust, there are 2. It's important to build that so that we can engage better with all the stakeholders involved in the process. That would bring us to give us a very sustainable system. But it's important to keep in mind that in this digital era where everything is very fast and changing, it's important that we keep working on trust. It's not something that we can take for granted at any time. So this is something, a work in progress, I would say, that by working together, we also need to make sure that we can update all the stakeholders as the changes come in. And we know that this is coming in very fast. So I think there is a lot of collaborative work to be done, and a lot of to build that trust. And that this is just the start of the journey, and we need to keep working together on this.
Thank you very much. So collaborate to build the trust on a long journey. Toni, from the point of view of the researchers, you maybe have a slightly different angle on trust. Maybe yours is more around trust in the quality of the data, but share your feelings.
Yeah, that's very interesting, Petra, because on one hand, I subscribe 100% what Elizabeth said. I feel the perspective is exactly the same. Maybe there is this additional element that emerges from the science field, that science is based on rigor and is based on generating real evidence. And that's something that we still need to work on. But I'm a firm believer that you build trust by doing. So I think that in parallel of the enormous work that represents creating the appropriate frameworks for developing the journey, like the European Health Data Space, in parallel, we have to maximize the opportunities that we already have for working together and creating the success stories that at the end of the day are going to convince the entire society, the public, that this is the way to create this kind of, let's say, common project that we call the European Health Data Space. And at the end of the day, building an identity as European citizens.
Thank you very much. That's another interesting perspective. Cecilia, trust. Your industry knows about building it, earning it, and sometimes losing it. What can we take from your side?
I mean, everything that's new and innovative, mistakes will happen. I really believe that it comes from understanding. If people understand and if they feel it's their project also, then they will also understand, and they will also understand what to improve and when is failure and when is not, when is it just one step towards success. Maybe I would like to compliment actually the European Patients Forum that you have done this campaign, Data Save Lives, right? You are actually creating that trust. You are educating the patients so they do understand what is data. Because for many people, we have this, saying AI is dangerous. No, AI is not dangerous. AI is saving lives. This is exactly why we'll be able to find cures for cancer and know that when that people have, maybe who will have future of cancer and can treat them before they get it. So AI and data is saving life. And I think what you are doing is like, keep up the good work and let's make sure that we pilot. Let's make sure that we have advocates, patients that says, this is exactly how it should be done. This really benefited me. caretakers that say, you know, I am doing this and I get much more time for my patients. I get much more quality decision making. You know, I can really give treatment on a different level. The proof is in the pudding. And thank you to you guys, because you're doing your part. And we will certainly do ours also.
Thank you very much. Now we're really right down to the clock. Ioana, I don't want to cut the word from you. I'll give you 10 seconds.
Thank you very much. So we really count on your support and your participation in building together the European health data space. And also we really count on your wisdom in helping us to do something useful for everybody.
Thank you very much, Ioana, for coming back to that last word. It is about wisdom, and wisdom comes from the crowd. So we are the crowd. Let's share our wisdom and let's make this European health data space work. Thank you for an excellent panel and for a wonderful conference over these last 4 days. Thank you and goodbye.
Thank you so much. Bye.
Thank you.